Hi there, my name is Dr. Selassie and you can find me at brooklynnaturopathicdoctor.com. Today I'd like to speak to you about 2 blood tests you should be requesting of your doctor that they normally do not run. And I insist as a naturopath that you have these tests run because they can tell you a lot about your own health and risk factors for disease, and there's a simple solution for improving your results. The first test I'd like you to ask your medical doctor to run is homocysteine. Homocysteine is an amino acid not unlike the amino acids used in the body to make proteins, but instead of being a beneficial amino acid, it actually contributes to poor health. Clinical studies have shown that 42% of patients with stroke had high homocysteine levels, 30% of patients with blocked coronary arteries had hyperhomocysteine, and so did 28% of patients with peripheral artery disease. Another study showed that the higher the homocysteine level, the greater the incidence of adverse cardiovascular events, okay? So heart failure, heart rupture, and death from a heart attack. So it seems that the way that homocysteine works is it elevates oxidative stress. It alters our lipid metabolism, so our ability to handle our fats that are going through our blood vessels, and also promotes blood clotting. Okay, so you can see how if you've got changes in the way that your body handles fat in the arteries and blood clots, and also lots of oxidative stress, you're going to cause disease in the arteries. So in order to lower homocysteine, so let's say you do go to your medical doctor and your medical doctor says, oops, you do have a high homocysteine level. Well, what can you do? What you need to do, or one thing you should do, is supplement with folic acid, B12, and B6. And these are all going to be vitamins that you find in a B complex. Okay. However, some may find that even with supplementation with a B complex, their homocysteine levels are resistant. And that's because some people carry a gene variant called MTHFR. MTHFR stands for methylene tetrahydrofolate reductase, which keeps them from converting folic acid from a supplement into an activated form that can be used by the body. It's a bioidentical form, okay? And instead what you can do is you can take a bioavailable active form, and if you look closely here, it says activated B complex isotonic. Okay, I think that might be backwards on video, but anyway, this is one example of an activated B complex that you can take that would, in a sense, has already turned the B vitamins into active forms. It's a bioavailable active form so that you don't have to rely on conversion. Okay, and the second test that you want to have your medical doctor check for you is if you have this gene blip, MTHFR, because if you're unable to convert your B vitamins to the active form, you will have not only trouble with homocysteine levels, so homocysteine levels, remember, will create vascular disease in your body, but you might also have problems with depression or brain fog, or having a hard time with miscarriage, not being able to hold that baby, or also having depression and brain fog. And patients with diabetic peripheral neuropathy are often have a positive MTHFR. And in that case, even those who don't have diabetes but do have some sort of peripheral neuropathy, oftentimes they can get some sort of relief with an activated B complex, okay? Another important thing that pathway helps you with is detoxification. So if you have this gene variant that does not allow you to methylate your B complexes, okay, and again, it's called MTHFR, you will have a problem with detoxification, which as a naturopath, if you're unable to detoxify, we know that could be a major contributor to disease. Okay, so have your doctor check your homocysteine levels and see if you're positive for MTHFR. And if so, you want to go to your local supplement store and ask for a methylated B complex or an activated B complex. Or better yet, you can order this one from me. see the link in my newsletter, or you can contact my office at 888-228-2126 or email us at contact@drselassie.com. So that's it for today. Thanks for listening, and I'll talk to you soon.